Carleton Place in Spencerville. So our catchment area is quite wide. What we're offering at our HART Hub is no different to that. The outpatient clinic will have walk-in services, so for substance use specifically, but you can walk in anytime during our business hours. You don't need a health card or anything. We do all of our work pro bono. We don't charge for any of our services or anything like that. And with that, you can see a prescriber, so a doctor, a nurse practitioner, or a physician assistant for any sort of prescription level needs you need for your substance use. And then we'll also have other walk-in services available as well, like social workers, case management, caseworkers, peer workers. We'll also have some crisis support available there as well. And again, you don't necessarily need an appointment. If folks might have follow-ups and appointments coming there, but you can really realistically walk in at any time. It can be related to that site, so we have one small section there that's actually staffed 24/7 with a nurse as well as a withdrawal counselor for individuals that are withdrawing from substances and need to be in a bit of a safe environment. So think of mom or dad at home that has kids, but they're also struggling with substance use. The parent doesn't want to be around the rest of the family as they're withdrawing. We can provide them that safe space, medically supervised in our center, and then get them into a better spot to go home in. And then if you require longer service on top of that, that's when you might get transferred to our secondary site. The only reason we have 2 sites is because we couldn't find enough square footage in one building to have it all in one spot. And that site is actually adjacent to the Royal Ottawa Hospital on Carling Avenue to be a part of. But we understand, when you see news that a substance use clinic is coming to the community, it can cause a bit of unrest and concern. So we're happy to answer any questions you have, and if there's any gaps in what's been communicated so far, we love to take that feedback because it helps us learn in the future how to communicate best with the community as well.
Yeah, we really want to spread the word in the community that our service is coming. If you know somebody who might be able to benefit from our services, starting at the end of March, beginning of April, you can send them our way and we would welcome them through our doors. And we also want to make sure that we're as engaged and connected as possible with the local community, knowing that, as Anthony said, sometimes the idea of having substance use health services causes worry or concerns, or you might have pictures in your mind about what that's going to look like. And we just really want to have the opportunity to share what our service is and what it's going to look like. And to convey that we are here to be good neighbors, to be part of this community in a good way, and we want to open up the lines of communication early and be here to answer your questions, sort through concerns, and work together.
That's how it's called. I always say if I had to choose the name, I probably wouldn't have called it that, but it was the name that was given to us by the province. When we talk about homelessness, we're really talking about housing in general. And when I talk about the differences in the hubs, one that's located more in a downtown core might focus a lot more on the population that is unhoused. And we still might experience some of that population here because there is an unhoused population that is in Bellscorners as well. But really we're focusing on housing stability and housing precarity. So thinking of individuals who are already home in this area, at risk of losing their home and ending up in that unhoused situation, we help to prevent that. So we have services available to help keep people in their homes and keep them stable in their community. Again, we support everybody, and if someone does come to us that's unhoused, we're happy to help them as well. But thinking of what we've done to improve research before, knowing where to put the funding, we're expecting more of a housing precarious population in this area where folks may be struggling to stay in their already existing homes, and that will probably be a large amount of service in terms of this. We'll be able to help with that as well. So it's not necessarily always an extreme case, but we will see all walks of life coming through the doors.
The HART Hubs are different. Are there any that have been in operation for approximately a year, like in the area, or?
There's a couple of different streams of HART Hubs. So there's many different types that have converted from safe injection sites or safe consumption sites into HART Hubs. Those sites had to get ready and going right away because they had a population that had services, and all of a sudden the services were taken away. So those sites have been active for quite some time, so including one that's in downtown Ottawa. We're part of the group of HART Hubs that's net new service, meaning that we never existed before, and we're actually doing a service that Pinecrest Queensway hasn't done before either. So we weren't necessarily related to the closure of those sites, but there are some sites that have been operational, but under a different model, just to keep things going and keep people safe with the closure of those sites.
Consumption site, if that is needed by the community?
That's outside of the scope of what we'd be able to do, that we're funded. We're actually explicitly prohibited with our funding from offering safe consumption. So no, we do not anticipate that at all.
And direct people if there is a place downtown or somewhere to go if they need to do that, but we cannot provide that in our area of care. We're also not allowed to provide what's called safer supply. Safer Supply is a harm reduction program where if there are individuals who are unable to come off of substances with regular treatment, they actually get prescribed a replacement so that they're using a safer substance. We're not allowed to provide that at our site. And we actually don't have pharmacy services at our site either. The intent being that our goal really is to keep people stable in their home communities and part of their regular circle of care. So if someone goes to the Shoppers Drug Mart down the road for the rest of their prescriptions, we will prescribe their prescription to that Shoppers Drug Mart. Addictions, recovery, treatment. Yeah. But again, I would say housing and substance use, recovery, and treatment, because I find it's a bit of a more realistic term for what we're trying to center. So outside of our clinical services, like our social work services, folks wouldn't come there to just hang out during the day for any specific reason. Folks are coming in to access a specific service, so see a prescriber, see a social worker, have an appointment, have a follow-up, and then go back about their day. So we're not expecting folks just to hang out there. We do have built-in space for community rooms, which we're really excited to use in terms of that we have people that want to provide like community fund related services, that they're able to do that there. We're focused on rebuilding life skills and stuff as well too. So if there's a knitting group that wants to have a knitting class there once a week and we can help that out, or a resume workshop, those are specific events that we might hold, but nothing that would focus on people staying there every single day.
No, I think what we anticipate you'll see is what you would see with any other medical clinic, which is people coming and going to access their appointments, but it isn't a drop-in space, as Anthony said. It's not a place where people will be congregating, other than maybe coming to a designated event that's occurring.
We do have the events, and you're experiencing hardship from that, like hospital admissions, overdoses, infections. In some places called safer supply or prescribed alternatives, and individuals can get prescribed a replacement drug to use however they wish because it's a safer substance to use. We wouldn't be providing that service. We provide like a medical treatment. So if, for example, if you are consuming large amounts of alcohol and you'd like to reduce your alcohol consumption, we prescribe a medication that focuses on alcohol cravings. Not a replacement for it, but just like you get a blood pressure medication to help with blood pressure, we would give you an alcohol medication to reduce your cravings for alcohol. Actually involved in our site, adjacent to the Royal, they're our pharmacy provider. So they are connected to our project in that sense, and they help provide some pharmacy related guidance. They are quite big experts in this field, and we're very happy to have them. They're not one of the core service partners, but they're one of the partners that we connect with in the community to help provide our service.
There's a pharmacy, yeah.
Just if we're connected.
I wondered about that, because they came and gave a presentation, and they actually spoke about what you're talking about.
People who may wish to access our services, or have a loved one or a neighbor who may wish to access our services, know that we're here, because that's going to be a big challenge for us, is getting the word. I've heard today that we're here to be good neighbors, that we're anticipating we're going to look like any other medical clinic, and you're not going to see lines of people or other sort of disruption, but also that if there are any concerns, we're here to talk them through and to be part of the solution and to be a positive contributor to the community. So really, I think like helping us with our work to kind of build relationships in the community for those two purposes. Really want you to reach out to us and let us know. Anthony and I will both be there. They, will be a regular presence at the site. That's where we're going to be based. We want to hear if there are concerns bubbling up. We really, really welcome you bringing those forward so that we can address them. We can understand them and then address them. So for now we have the info ad, but we will be getting our own website, and that will include contact information. So either email that info ad number or Google West Ottawa HART Hub, and you'll find additional information. The information leaflet that I send will also point you to our website. Or come by and ask for us. We're happy to, we're here to work through problems.
Our staffing, my Excel sheet is very large, so I have to think, so we'll probably have close to 10 to 12 staff on site every day. So
overall, there's
like at one time.
Yeah, overall between the two sites, and remembering that There are some 24/7 services, there's about 50 staff, but at any given time at Bell's Corners, it would be 10 to 12
Yeah.
people on site.